also will put it in the chat feature as well. But also in the coming days after this meeting, we'll be sending out the PowerPoint answers to the questions during the session, as well as this recording. So if you would like to receive those, please sign up for our email updates by scanning the QR code that you see there on the screen or clicking on the link in the shared chat. And then finally, we will also be uploading the recording to our virtual connection hub page, and you can check it out there as well. So before we begin our South Region work group report outs, I do want to briefly highlight our mission, which represents a commitment to improving the well-being of the South Region community through collaboration, policy, system, and environmental changes that promote equitable, healthy, safe, and thriving communities. And our South Region leadership team actually identified 3 priority areas that we are focusing on. We have food insecurity, behavioral and mental health, and homelessness. And these work groups are really established to coordinate action, track progress, and strengthen our collaboration together. And so now, as Jeanette had shared what the agenda will be, you're going to hear from our work group co-chairs who co-lead these priority areas. So I'd first like to pass it on to Karen Clay and Elizabeth Prado, who will talk about our food insecurity updates.
Thank you. Hi, everyone, and welcome to those who are new. Our work group's vision is to move towards a South region where everyone has sustainable access to culturally appropriate, affordable, and locally sourced healthy food, supported through strong partner collaborations. We remain committed to our goal of establishing a South region food hub that serves as a centralized community resource for accessing and distributing healthy, locally sourced food. Recent efforts include convening partners to advance the food hub, exploring mobile cold storage solutions, and learning from other counties to strengthen our regional approach. To continue making progress, we invite anyone who's engaged in or aware of initiatives aligned with our food hub goals to connect with us. Thank you.
Thank you. And next, I'd like to turn it over to Angel Ibada, who oversees and co-chairs our behavioral mental health work group.
Hi, everyone. Good afternoon. I'm Angel Ibarra. I'm with the City of Chula Vista. Thank you for being here today. And it's really exciting to see so many familiar faces and exciting to see so many new faces. So welcome if you're new. I, along with my co-chairs Pua and Angie, lead our behavioral mental health work group. So this month, the behavioral and mental health work group is currently drafting a youth mental health resource tip card to distribute in the South region. This tip card will feature a QR code connected to a link tree that leads to a list of mental health resources for youth and teens, such as 988, Bright Life Kids, Own Your Mindset, and more. During our next meeting, the work group will be reviewing the first draft of the card and providing any comments or feedback.
Thank you. And is Tony here from Imperial Beach for our homeless work group report out? I don't know if I saw Tony.
Did see Merlin
Oh,
join
Merlin's
us.
here. Oh, great.
Yes, yeah, I don't think Tony is on, so
Okay.
I can provide the update. Hi, everyone. I'm Merlin Watanabe from the Regional Task Force on Homelessness, and I co-chair the homelessness work group alongside Tony Rolfe from City of Imperial Beach. Last year was a very foundational year for us to get a lay of the land of what homelessness looks like in the South region. And we really focused on what a system mapping would look like to really identify the gaps and the needs and strengths of our communities. And so this year, we're really looking into delving deeper into the system mapping, but on specific issues and challenges that communities are facing right now. We recognize that homelessness is also such a very broad umbrella that connects to all the work that the other work groups are doing, but also has a lot of intricacies. We know that there are also so many challenges and changes with funding sources, staff capacity, shifts in resources and services that are available in the community. So our goal for this year is to really focus on creating generally like a hub where people who are working in any area of homelessness can really connect and network, but also share resources and really work towards identifying solutions that could be implemented in their community, whether that's housing problem solving, diversion, any type of solutions that would be very specific to our communities. So, yeah, for everyone who's joining for the first time, thank you for coming, and please join us for our future meetings as well. Thank you.
Thank you so much. And a big shout out to all of our co-chairs that run our groups. They do phenomenal work in leading us through very complex issues in our community. So thank you so much. And if you're interested in joining a Louisville San Diego Regional Community Leadership Team, you can see the agenda or the oh my gosh, I'm sorry. The dates and times. I'm so sorry, everyone. The dates and times there. Please scan the QR code that you see there, or you can use the link in the chat to sign up, and you can subscribe to and receive updates. And so now I'm going to turn it back over to Jeanette, my co-chair.
Thank you, Valerie, and thank you, co-chairs. So it's always so impressive. I hear it every month, and every time I just feel super proud of the work and the commitment from the co-chairs. So now I'm pleased to introduce our first speaker, Claudia Gurola, Chief of Self-Sufficiency Services, who has 27 years of experience serving the County of San Diego Health and Human Services Agency, overseeing programs such as CalWorks, CalFresh, Medi-Cal, General Relief, and County Medical Services. She's here today to talk to us about upcoming changes to CalFresh under HR 1. Claudia, welcome, and I'll turn it over to you.
Thank you so much, Janet, for that introduction. And thank you, all of you, for asking us to come to your platform here and share some information regarding House Resolution 1 and how it will impact CalFresh benefits. There are a lot of different items that may be impacted due to House Resolution 1, which I will refer to as HR 1 moving forward. But today we're going to focus on the changes that are taking effect early on, starting in April, so that we don't, give you a wealth of information that may just be a little bit too much. So focusing on CalFresh. A little background regarding House Resolution 1, HR, also referred to as HR 1, is that it was signed into law on July 4th of 2025. And the provisions that, I'm so sorry, I wasn't sharing my screen. Thank you for catching that and putting it on or I can share now. Would you like me to share? My apologies.
Claudia, and also I'm reading some of the comments that it seems a little bit muffled. So I don't know if you can adjust your speaker. Sounds good from my end.
Can you guys hear me better now?
Oh, yeah, that's a little bit better for me.
Okay, I will try to
Yes.
speak
Get a
out.
thumbs up.
That will help. And again, my apologies. I just totally blanked in sharing my screen, but I will get us started now. As I was saying, HR 1 was signed into law on July 4th of 2025, and it introduces two changes to the CalFresh program. One is related to citizenship eligibility, and the other one reintroduces what we refer to as able-bodied adult without dependents work requirements. I will be talking about both of those items throughout this presentation. First, I will get started with the citizenship changes that we are going to see taking effect on April of 2026. So beginning April of 2026, there will be changes to the citizenship categories that are eligible to the CalFresh program. What that means is that these changes will be the new rules will be applied to applications received April 1st and moving forward. And for households that are already receiving CalFresh, they will take effect at their recertification period. So what that means is that come April 1st, there will not be like a query of all individuals who are receiving CalFresh and then the new rule will be applied. It's more going to be applied when they're due for their annual renewal. At that point is when citizenship will be reevaluated for these households. The changes that have been introduced, so that will be introduced to the CalFresh program beginning April 1st, is that CalFresh will now be limited to only the citizenship categories that we see here on the screen, which include U.S. citizens, U.S. nationals, legal permanent residents, Cuban and Haitian entrants, and individuals who have been admitted to the United States under the Compacts of Free Association, also referred to as COFA. Another change that HR 1 has introduced are work requirements. Now, these work requirements, I need to be very clear, is that they're not new to the CalFresh program. CalFresh program has always had work requirements in their policies. The thing is that in San Diego County, we have been functioning under a waiver because our unemployment rate had qualified us for this waiver. Now, with HR 1, they made changes to the percentage that an area had to reach in order to qualify for these waivers, and they increased it to an unemployment rate that's above 10%. San Diego County does not meet that, and for that reason, our waiver was taken away, and we will have to reintroduce work requirements. So, these work requirements will be reintroduced beginning June 1st of 2026. Same concept that I just shared with regards to citizenship. That just means that effective June 1st of 2026, anybody who applies for benefits will be evaluated based on this new rule for work requirements. Households that are already receiving CalFresh benefits will have the new rules introduced to their eligibility determination during their annual renewal, beginning June 1st and moving forward. So again, this does not mean that all households beginning June 1st, if they're receiving benefits, that this will impact them all at once. This will be a staggered implementation as they come up for their annual renewal. So, who will this apply to? The work requirements will apply to individuals who are between the ages of 18 to 64 and who do not satisfy a work exemption. Work exemptions are a very long list of exemptions, but they include things such as having some form of limitation, whether it's physical or mental limitation that may prohibit the individual from engaging in a work activity. It could be pregnancy. It could be that you are caring for a person who suffers from a limitation. It includes various categories. Now, I have to be very clear on this too. Right now, we have received very general guidance from the state of California on how to impose all of these work requirements. We still have one item pending from them that is going to offer us more clarity on how to assess for these exemptions. I share this piece because we may be eager to learn more about whether or not our customers would qualify for an exemption. I just want to be forthcoming in sharing that we may not be able to provide great detail on that matter right now with the information that we have available. But prior to June, we are hoping that the state does provide us all that clarity so that we could share more details on this matter. So some exemptions that have gone away due to HR1 implementation, which had been introduced actually during the public health emergency, were exemptions that were allowed blanketly to all veterans and exemptions that were allowed for individuals who were experiencing homelessness. Also, youth under the age of 25 who were in foster care on their 18th birthday would also have been exempt prior to the implementation of HR1. These three exemptions are going away come June 1st when we move forward with the work requirement. HR1 did introduce some other changes, which include the increase of age for the participants. Prior to HR1, the age used to be 18 to 59. Now that we have HR1 and beginning June of 2026, we will be, that age has increased from 59 to 64. So it goes now from 18 to 64, but the change was just increasing it from 60 to 64. It also lowered the age for dependent children. Prior to HR1, any household that had a dependent child under the age of 18 would be exempt from having a work requirement imposed on their case. Now that age has actually decreased from 18 to 14. So the rule now is that they have to have children under the age of 14 instead of 18. HR1 also introduced a new exemption, which is a positive, and it's an exemption for Indian, Urban Indian, and Californian Indian Care Improvement Act. So individuals falling under this category would be exempt from the work requirement. So what are the work requirements? Work requirements will, if individuals fall within the criteria that I just shared, meaning that they're within the ages of 18 to 64, and they are able-bodied adults without dependents, meaning they do not have a dependent under the age of 14 living with them, and they do not satisfy any of the exemptions that we will be assessing each customer for. These individuals will be required to engage in some form of work activity for a minimum of 20 hours per week or 80 hours per month. Work activities range. They're not limited to just being employed or self-employed, but it can also include things such as community service or volunteer work. We also have a CalFresh employment and training group, which consists of social workers who can help if a customer volunteers in participating with these social workers. They can assist them in guiding them on how to engage in some of these activities. So we know that this is going to be something different for the public, and it's very publicized out there with the laws coming in. So the County of San Diego is being very proactive in making sure that all our recipients and the public who may be interested in getting more information is well aware of the changes that are coming in. And we will continue promoting more information regarding these changes by form of using text campaigns for active CalFresh recipients. We'll be also using robocall services that will be alerting some of our households that are receiving CalFresh of these changes, letting them know that at their redetermination or annual renewal, that they may have to be asked to engage in some form of work activity. Our website also has been updated to include the information that I just shared right now. And we're also working on with the state, the California Department of Social Services, and creating some outreach material that they will be sharing with everybody. So that concludes my presentation. Now, we did receive some questions ahead of time, and I'm not sure if you want to handle the questions now or after Anna's presentation?
No, Yulia, let's hold over the questions about this topic until after Anna's presentation, because she'll be sharing also related questions to CalFresh and HR1. So after Hunger Coalition presentation, we can do kind of like a joint Q&A, and that way we approach question in a more holistic way. I still see in the chat that your audio seems a little bit choppy, so maybe, well, Anna presents. I don't know if you can adjust your microphone a little bit. I understand everything, but I think some people still put it in the chat that it seems a little bit choppy.
I'll see what I can do. Absolutely.
Okay, thank you. Thank you. We appreciate that. So our next speaker, Ana Evangelista, Community Impact Manager with the San Diego Hunger Coalition. Ana joined the San Diego Hunger Coalition in 2024. Prior to that, she also worked with CalFresh team at UC San Diego, where she served as an application assistant, acting as a point of contact between county and students to resolve application issues. Anna is also joined today by Andrew, an outreach specialist working with the San Diego Hunger Coalition. Welcome, Anna and Andrew. I'll turn it over to you both.
Thank you so much, Jeanette. I really appreciate all of you having us here today. We will be going over some important updates, of course, related to HR1, how it's really going to impact CalFresh, our communities, and what organizations and providers can really expect moving forward in this first half of 2026. Before we do get started and going over all that, it is important to, of course, go over nutrition insecurity here in San Diego County. And so I will pass it over to my colleague, Andrew, to talk a little bit about that.
Perfect. Thank you, Anna. First let's go ahead and talk about nutrition insecurity. At the San Diego Hunger Coalition, we do define nutrition insecurity as an individual's inability to purchase 3 healthy and nutritious meals a day. And we also classify the nutrition insecure population as families with an income below the 225% of the federal poverty level. So I do want to note that this slide doesn't have entirely accurate numbers because we used to compare it to the 200% of the federal poverty level, but now we do it to the 225% of the federal poverty level, since that was a little more accurate with the nutrition insecure population. So we look at this table here. Essentially, the way it would work is that a household of 4 would have to earn less than, I believe it's 74,250 in their income, since that is below the 225% federal poverty level. And again, if they earn less than that, they would be considered nutrition insecure. Unfortunately, it's not on the slide there, but I believe that's the number. I think it's $74,250. Maybe we go to the next slide. Perfect. So this table is really interesting too. Essentially, more than 1 in 4 people in San Diego are nutrition insecure. And something that I want to point out here is that if we look at the graph, we can actually see that after December 2024, we can see that the nutrition insecurity rate actually increased to 26%. And then in December of 2025, it starts to decrease. So that does mark that was the first time in a year that nutrition insecurity actually decreased. However, throughout the entire year of sustained high levels of nutrition insecurity, that ended up resulting in a meal gap of 6 million meals in December of 2025. And then here, this is a little table to break down these numbers by population a little further. So as I mentioned in the previous slide, San Diego County had a nutrition insecurity rate of 25% in December of 2025. So this means that 32% of children, 25% of older adults, and 37% of people with disabilities all throughout San Diego County are nutrition insecure, or were from December 2025. And then here we have a pie chart that actually breaks down the number of meals that were provided by the various food assistance programs across San Diego County, again in December. So one of the first things that I want to note here is that the hunger relief sector in San Diego County provided a total of 27.7 million meals across all of these different programs. And as you guys can see on the right there, 57% of those meals are from CalFresh, which does mean that it is the most effective food assistance program in the county. However, despite all of the meals that were provided across all of these programs, the county was still short by 6 million meals. And again, that means that thousands of families went hungry during this month alone.
Yeah, and I just want to note, we can see here that there are many sectors comprising the hunger relief, sector, many programs that provide support to nutrition insecure families. But CalFresh is one of the most important ones, and HR1 is really attacking this major resource that families are making use of at this time. And so the first thing we just want to go over is Claudia went over all of the immigrant changes coming to CalFresh for immigrant eligibility. Many are going to be losing benefits, including immigration statuses like refugees, asylees, survivors of human trafficking and domestic violence, so U and T visa holders, for example. CDSS has estimated that there are roughly 72,000 individuals in California who are enrolled in CalFresh who will likely lose their ability to access benefits due to this immigrant eligibility change that is coming in April. It is really important to note, and Claudia mentioned it earlier, that households who are currently on CalFresh, they can be eligible to remain on benefits until their next recertification, even if it is after April 1st, when those new immigrant rules will start to be enforced. And so this is going to create a bit of a buffer period for immigrant families who are currently on benefits because they can continue to receive CalFresh until their next recertification. And the county will evaluate the household at that time. For any mixed status households that contain both citizens and maybe newly ineligible individuals, they will go ahead and evaluate each person separately. They will treat ineligible non-citizens as an excluded family member, and this does mean that anyone who is still eligible can continue to remain on their benefits after their recertification. Because there is going to be that buffer period where families can remain on benefits after April 1st, it is very vital and very important to perform CalFresh outreach in this next few weeks. It will help us minimize the number of people who lose access to their benefits and hopefully maximize the number of people who can stay on benefits after the rules start to be enforced. Of course, although we want to encourage people to apply, we do acknowledge that some families may hesitate to apply due to public charge. Public charge scares off a lot of people from applying. Currently, it does not count. CalFresh does not count against someone in a public charge determination. And this means that currently, CalFresh participation will not impact immigration status, and it will not impact someone's ability to update their immigration status or become a naturalized citizen. However, some of you may have heard the current administration did propose changes in the latter half of 2025. Although nothing has officially changed as of yet, the public charge rules established during the Biden administration still remain in place for now, again, meaning that CalFresh is not considered in a public charge test. This is not the first time our community has been put in this position of, uneasiness, and, it is important to, of course, make sure that our community stays informed. Families should have the right to make informed decisions. And although CalFresh, again, is not considered a public charge yet, we do not know when or how exactly things will change. But of course, it is important to also know that the public charge test does not impact all immigrants. There is a lot of misinformation floating around surrounding public charge. Here in the US, this public charge inadmissibility test primarily applies only to people seeking a green card from their family, a family-based petition. And again, it will not affect the vast majority of immigrants who are currently eligible for CalFresh. So many groups as well are also exempt. So this includes refugees, asylees, people who are here through VAWA, U visa, and T visa. And so, although public charge is scary and people are, afraid of impacting their immigration status by using CalFresh benefits, it is just very important to know that many immigrants are not actually impacted by the use of CalFresh, and they will not be subject to a public charge test. The Protecting Immigrant Families Coalition, or PIF, has a number of different resources that provide really clear information and educational materials about these policies in place. It's definitely hard to go over all of the public charge rules and things to know in the short period of time that I have you with me. And so I do highly encourage you to visit PIF. I do believe Cassandra and Jeanette, if you'll be sharing these slides with everyone after, so you can feel free to visit this link on the slide here. Of course, another concern that I do just want to bring up as we try to encourage families to apply for CalFresh is the fact that data privacy has been a rather big concern in these past few months. The federal government has been making attempts to access personal information of people who receive CalFresh. In response to this, many states, including California, have taken legal action and they have sued the federal government to stop this. And there is a temporary court order that is currently preventing Californian states from sharing this information with the federal government. California has not shared any information to date about any CalFresh recipients. However, we don't know what steps might happen next at the federal level. And again, although we want to encourage people to use benefits, especially if they're eligible right now, of course, we just want to be transparent with this information and make sure that families are able to make informed decisions. When it comes to, applying for benefits, there are some important privacy protections that people need to know and understand. You are not required to share any information about a household member who is not applying for benefits for themselves. So just for example, if you're working with a family and you have an undocumented parent who's choosing to apply for their child who is a citizen, the parent can choose to opt out, apply solely for their children who are citizens, and the parent cannot be expected to provide any information about their immigration status. They would never need to disclose that they are undocumented. They never, again, need to disclose that that's the reason why they're choosing to opt out. They would simply opt out and they can't be required to provide any information beyond that. Other things to know when it comes to data privacy, disenrolling from benefits does not erase information that is already in the system. So that is something that people should know if they are currently on benefits. The government already has your information. They already have your social, your address and all that if you are already on benefits. And so it may not even be beneficial to fall off of benefits if you're already on it. And I noted this earlier for public charge, but many immigrants who are currently eligible for CalFresh are historically not at high risk of immigration enforcement. And again, of course, I just want to share that PIF, or Protecting Immigrant Families, has another fantastic database of flyers available that detail data privacy. When it comes to the immigrant eligibility changes that are coming next month in April, I do recognize that people are going to have, a number of different questions about how exactly it's going to work, what can they really expect. And so CDSS, or the California Department of Social Services, has created an informational flyer and a frequently asked questions flyer that organizations can share with their community. This resource provides a really clear explanation of the eligibility rules, and along with some, again, frequently asked questions that families may have, and they are available in different formats for accessibility and in different languages as well. I believe they have, at this time, English, Spanish, Arabic, Chinese, Farsi, Russian, and Vietnamese available. And I believe Andrew can share the link to these flyers in the chat. But again, they are available on the CDSS website in all of the languages I just listed. Of course, there are some immigrants who are losing eligibility for CalFresh, but it is important to note that some immigrants who are ineligible for CalFresh may be eligible for an alternative food resource, which is CFAP, or the California Food Assistance Program. And this is state-funded food stamps. It functions very similarly to CalFresh. The only difference is that instead of being federally funded, it is state-funded through California. Uh, the immigration statuses that can be eligible for CFAP include legal permanent residents of less than 5 years, parolees, regardless of their length of parole, conditional entrants, and battered citizens or VAWA self-petitioners. I do want to note, unfortunately, the majority of immigrants losing eligibility for CalFresh are not going to be eligible for CFAP, with the exception of battered citizens and certain parolees. So the majority of immigrants losing eligibility, again, are not going to be eligible for this program, but it is important to still know about because there are some groups who may be able to make use of it. CFAP does use the same application as CalFresh, so there isn't a separate application or a separate form or website that you would go to apply for this program. You would simply go to Benefits Cal and you would use the CalFresh application itself. The county would evaluate the applicant and determine whether they would qualify for either CalFresh or CFAP if they qualify for either program. All right. When it comes to ABOD, again, I'm not going into too many details because Claudia did a fantastic job talking about some of the, ABOD rules and changes coming. She mentioned earlier that when it comes to ABOD, CalFresh participants are going to be required to show that they work volunteer or are in school or training at least 80 hours per month. And this, of course, can include a variety of things like paid work, including things like self-employment, unpaid work like internships, in-kind work, for example, if you're working for your landlord to reduce your rent payments, volunteering, CalFresh ENT, that stands for employment and training, or a combination of all of these activities. It is, of course, important to note that there are resources available for individuals to meet these work requirements. Organizations like 211 San Diego, Kitchens for Good, and the San Diego Workforce Partnership provide training, employment support, and job placement services. And all of these programs can really help individuals, gain skills, find employment, and hopefully remain eligible to continue receiving CalFresh benefits. And again, I know these slides will be shared, and everything here is linked, so you can very easily access it. It is unfortunately CDSS is still in the works preparing outreach material for the ABOD rule change, but they will be creating flyers similar to the immigrant one that I just shared with all of you. We will be sure to add it to our website once they are available. And of course, you can always feel free to visit their website or visit their website to find the latest guidance from them. So what can organizations, expect as these HR1 changes come into play? These policy changes are going to create, a set of challenges for many of us, both the CalFresh participants and the organizations who are currently supporting them. We will likely see, of course, increased demand for emergency food assistance, especially food assistance programs that do not require personal information. CalFresh outreach funding is also going to be reduced starting October. CAFB, or the California Association of Food Banks, has estimated that federal reimbursement for CalFresh outreach activities will be reduced by 14 million, which will, of course, make it harder for organizations who are doing CalFresh work to continue doing so and to continue getting families onto the program. And of course, you'll likely receive lots of questions from families. These are, new rules, and for many of these folks, it can be difficult to keep up with all of the changing policy, especially when they're already working and they're already busy, taking care of their families. And so to really help organizations, we have developed an HR1 toolkit. It has a really condensed version of all of the HR1 changes coming, what you can expect. It has information on, when these changes will take place. It has a frequently asked questions portion as well. So it is really useful for folks. We will have it up on our website later this week. It isn't available yet, but again, it will be up on our website later this week. And of course, we do also encourage organizations to continue to advocate for CalFresh outreach funding. CAFB, 211 San Diego, and Aliados Health are advocating for a state budget request to fund CalFresh outreach efforts. And if approved, this funding would help replace federal dollars for these CalFresh outreach programs that we're going to be losing in October of this year. There is an organizational sign-on letter. There is no formal deadline for this, but we do encourage early sign-ons. And of course, individuals can also take action themselves by sending a quick email in support of this request. And of course, we do also want to share other food resources that are available as we continue to navigate some of these policy changes coming to the CalFresh program. And I will pass it back to my colleague, Andrew, to talk a little bit about this.
Awesome. Thank you, Anna. Yeah, and as you guys can see on the slide here are a few alternative food assistance resources that are available here in San Diego County. So we have WIC, which stands for Women, Infants, and Children. We have Sunbucks for school-age children. We have Meals for Older Adults, which is congregate meals and medically tailored meals. And then lastly, we have food distributions and pantries. Alrighty, so first up we have WIC. As I mentioned, this stands for Women, Infants, and Children, and that's typically children that are going to be 5 years and younger. Essentially provides them with cash benefits for healthy food and nutrition information, as well as breastfeeding support as well. One thing that is worth noting here is that immigration status is not affected or does not affect eligibility for WIC, which is really nice given some of the CalFresh changes that are coming up. And if anyone needs any assistance in applying for WIC, they can actually do so in person. There are a few different WIC offices throughout San Diego County, so you can go ahead and just search up sdwic.com, and then you can fill out some information, and it'll show you the nearest WIC office to your location. And then next up here, we have Sunbucks, which is the same as summer EBT. And I do want to provide a little bit of context for this one by mentioning that California was the first state to provide free school meals to all children back in the 2022 to 23 school year. But what happens when summer comes around and school is out? Essentially, kids aren't on campus to receive their meals. So because of this, the summer can actually be the hungriest time of the year for those kids. And with that in mind, Sunbucks is another food assistance program that aims to bridge that hunger gap during the summer when kids lose access to those free school meals. It essentially provides eligible families with school-age children with $120 worth of grocery benefits for that summer. And one nice thing to note is that families who are already enrolled in CalFresh at any point during that school year, they are automatically certified for this program. And again, immigration status does not affect eligibility for this program as well. So if anyone wants any more information, they actually have a helpline. It's like the Sunbucks helpline, and you can call 877-328, and then I think it's 877-328-9677. And then here we have Meals for Older Adults. So essentially in the county of San Diego, the county contracts with community organizations to provide free meals for eligible older adults at various locations all throughout the county. So if you want a list of some of these meal providers, you can actually find that on the Health and Human Services Agency's Nutrition Services page. And you can actually see a picture of what that list looks like here on the slide on the right side. And once again, immigration status does not affect eligibility for that program at all. And then here we have medically tailored meals. So these are going to be free home delivered meals for people who are on Medi-Cal with a qualifying medical condition. Essentially, organizations can provide up to 3 nutritious meals a day for people that qualify. And if you're interested, a great organization that works with medically tailored meals is Mama's Kitchen, and you can connect with them by visiting their Get Help page on their website. Alrighty, and then last but not least, we have food distributions. So many of you guys may already be familiar with the San Diego Food Bank and Feeding San Diego, but for those who aren't familiar with them, these two food banks coordinate a lot of the food distributions throughout the county, which makes them one of the best starting places to find a local pantry or distribution site. And they both have incredibly helpful food distribution locators, which are essentially like these interactive maps for San Diego County that you can basically use to easily navigate and find the nearest food distribution site to you. So, for example, you can enter any zip code in the county, and the map will load to any nearest distribution sites in that area. You can also filter by specific days of the week, the type of distributions, and so much more. And I believe that these both have unique locations. So to truly find the best or the nearest food distribution options, it's best to visit both of the maps on each of those locators. And then just to wrap up here, if you guys would like a flyer of all these resources, we at the San Diego Hunger Coalition actually create a food assistance flyer, and we update it pretty regularly. This flyer essentially recaps a lot of the information that I've shared regarding these resources, and it actually includes even more regarding eligibility and provides some tables and a lot more. So it's pretty neat. And this flyer also is translated in 13 languages. So I highly recommend you guys check this out, and it is available on our website under the emergency food assistance category. And yeah, that's all we have for you guys today. If you guys have any questions, feel free to reach out to us, whether it's through email or giving us a call. Anna and I are more than willing to help out in any way or to answer any questions. I do believe we do have some time to answer some questions between both of us and Claudia, if anyone has anything that they want to ask.
Yes. And we did get some questions in advance. So thank you, Anna and Andrew and Claudia, for such a timely context. I know it's a lot to process. So let's dive in a bit more by answering some of your questions. I'll do my best to alternate questions from the chat and from those submitted in advance during your registration. We might not get to all of the questions today, but please continue to add them to the chat. We'll make sure to share the questions with the speakers and include relevant information as part of the recap email. So let's kick things off with the first question. Just know some of these questions are you might have answered already through the presentation. So this is just an opportunity maybe to dive in or clarify it a bit more. So first question. So in light of recent federal changes to CalFresh, what regional programs have continued to be sustainable? Let's hear from each of you on this question. So, Claudia, would you like to start?
Absolutely. So, as far, I'm sorry, can you guys hear me better this time? Yes?
Yeah.
Okay. I'm glad. I was able to improve the audio. As far as regional programs, well, as Anna already covered, for CalFresh, even though the citizenship changes are taking effect, there is that alternate program that we do already evaluate all customers for that can default for, which is the CalFresh Food Assistance Program, also referred to as CFAP. We other than that food assistance program, really, we offer the resources to refer over to food banks and things like that, but not necessarily other programs in itself that we determine eligibility for. Anna, do you want to add something to that?
Yeah, definitely. So I will note some of the food programs that Andrew and I went over are not being directly impacted by the HR1 policy changes that are coming. So just for example, WIC. WIC is going to continue to remain a really fantastic resource for pregnant women and their young children. There are, of course, other food resources that are not, again, being directly impacted at this time by HR1, for example, like summer EBT or Sunbucks. So really, those food resources are the ones that I would recommend really directing families toward. Of course, these food resources will not be able to encompass everyone who's losing benefits, but they are still really great to share as a alternative for those who can be eligible to participate in them.
Thank you for that. So we're going to go into our next question. And the next question is, I think that this is more related to or tied into the work requirements. This is what the question says. Can SSI recipients continue receiving CalFresh benefits? And what support is available for individuals with intellectual or developmental disabilities who need help completing the forms? Claudia, do you want to go first?
Absolutely.
Take this
So,
one.
SSI recipients may still continue receiving CalFresh benefits. Of course, SSI is not limited to just individuals who are aged or disabled. So, depending on how they are qualifying for SSI, they may or may not be impacted by the work requirements. We would have to assess each situation independently. With regards to the assistance that we can offer individuals who may need additional assistance with completing forms and obtaining documents, all eligibility staff would be available to provide that type of support. As well as I shared, we have our CalFresh employment and training team who consists of social workers who may be able to offer additional support if they were actually mandated to satisfy the work requirements as well.
Thank you, Claudia. And next question is also related to work requirements. Is there flexibility in meeting work required hours, mixing volunteers with work hours, remote volunteer options, informal modes of employment?
And the answer to that is yes, there is some flexibility that can be practiced there. We do have some, like I mentioned earlier during the presentation, we are pending some further clarification from the California Department of Social Services as it gets really into detail on how we will be exercising that flexibility and applying it when determining eligibility. But yes, there will be some flexibility.
Thank you. And our next question is, how would this recent federal changes affect people experiencing homelessness and access to food?
So, as I mentioned also during the presentation, during the public health emergency, an individual experiencing homelessness used to be applied as just a standard exemption for customers. Now, with HR1, they have done away with that blanket exemption for individuals who are experiencing homelessness, but that does not mean that these individuals will not be assessed for all other exemptions. And something that we're hoping that is further defined in the handbook that we are waiting from the California Department of Social Services is a little bit more detail with regards to the limitations and impairments that a eligibility worker will be able to use as independently to assess a person's ability to engage in a work activity. These work activity or work requirements, they're not just imposed on individuals who are exempted do not have to be receiving Social Security disability or SSI. It could be a very quick screening that an eligibility worker can do and complete during the interview to assess whether an individual may not necessarily be able to engage in such activities now. But that's the clarity that we're still pending from the state to see how it is that we would be able to assess that.
Thank you. And there's a question about how can our partners request presentation from both of you in their organizations. I know, Claudia, we have the link for you, so we'll add it in the chat. But Andrew and Anna, if you want to add that link of how our partners can request further presentations for their teams, that will be great.
Yeah,
There.
definitely. You can reach out to either Andrew or I. You can give us a call or give us an email. We would be happy to join any staff meetings and give a short little presentation on any of the HR1 changes or anything that we presented on today. You can just feel free to reach out via email or by phone.
And this one is also for you and Andrew, Anna. I know both of you went through a very extensive list of resources, but I just want to make sure, if there's opportunity to highlight other tips and tricks. How can we ensure we have updated information on food distribution? So what's the best way to keep a pulse on all the food distributions?
Yeah, that's a really great question, Jeanette. We do work very heavily with the food banks, and they have a team that does an amazing job of keeping their food distribution websites updated. They do include a lot of the times the contact information for the places that are managing all of these individual distributions. I would encourage folks to give them a call ahead of time just to make sure they have the most accurate information. But again, they do have an amazing team that does a great job of keeping everything updated. They also make sure to include, special information like special or expanded hours. Oh, and I do see in the food bank that San Diego Food Bank has shared their link to their GPS map of their food distributions. So again, they do a great job of keeping this map updated with the latest information.
Thank you so much for the information. And I know we're out of time for questions, but again, we're gonna compile all the questions, those submitted, that's those in the chat that didn't get answered, and we'll send via recap email. I'm gonna go a little bit off script. My team is gonna get mad at me because we're a little bit behind, but I will be remiss. We have some local organizations connected to the food distribution that are here with us today, such as I Love to Clean and LifeX, SBCS, that has, and that just to mention a few that I would love for them to highlight very high level if they have anything to add in terms of local opportunities for our partners to support the community at this time. Valerie, do you want to highlight anything? And if not, it's fine.
Sure. I know as an organization, we've been trying to increase the amount of times we're offering food distributions as well as the locations to make it in the evening. We now are at our main impact center on Saturday, so we're trying to remove any barrier. But I would say if you have ideas about how we can partner at a location, or if there's a time or the day of the week that might work best in eliminating barriers, reach out to our organization and we're happy to, see what we can do to add additional or switch a location. And I know we have more of our associates too, agency-wide, that are getting certified in CalFresh enrollment, also as a way to help remove any barriers as well. So those are a couple of things that we're doing, and happy to try and partner if people have opportunities that we can do with them.
You, Karen. Thank you, Valerie.
Yes, I just want to let everyone know, as you probably already know, we're going to be getting more people in lines all around the county. Anything that you can do to support food distributions, whether it's volunteering, monetary donations, or whatever, we were already behind in the amount of resources we have, and it's just going to be more challenging. So anything you can do is great.
So volunteer opportunities. Yes.
Yeah.
Elizabeth?
I just put our website on the chat, so if anybody's interested in volunteering and or, of course, giving our website link to anybody who needs to give resource information in extension to the food banks. We're also listed on the City of Chula Vista's website for anybody else who needs additional food resources. So it's on the chat for Life Hacks. Thank you.
Thank you, co-chairs, and thank you, Anna, Claudia, Andrew, for sending us some valuable information. We definitely need to invite you back as the conversation and as we get updates. So thank you so much. So in the interest of time, we'll go ahead and bring up our next speaker, Dr. Yair Melendez, who will be presenting on food support efforts for college students. Dr. Melendez, he's an educator, community leader, and a Venezuelan immigrant who is now a naturalized U.S. citizen who serves as a president of the Associated Student Government of San Diego College for Continuing Education and as a student trustee for the San Diego Community College District, advocating for student success and equity. Through his nonprofit, One Seed, he works to address food insecurity and support vulnerable communities to students, so students can focus on learning and achieving their educational goals. Dr. Melendez, the floor is yours.
Oh, thank you so much. I really appreciate it. I'm sharing right now. I think. Okay, I'm sharing now my presentation. You can see?
We can't see it yet. Yes, we can see it now.
Okay, perfect. First of all, I would like to say you thank you for having me, for bringing us together to address an issue that directly impact the student success. And I think in the human dignity as well, like the food insecurity. It is for me, it's an honor to be here today. But before I begin, I want to clarify that my remark reflect my experience as a student leader and community advocate. And no is the official position of the San Diego Community College District. But every week we are talking about the food insecurity in our college. You said my name is Yair Melendez. I'm from Venezuela. I'm serving right now. I'm serve the community college as a student trustee, and we are working every day for the students. So I think the food insecurity in education for us is the invisible barrier impacting the future of our city. I would like to say congratulations the speaker before me because you give it us the amazing information because it's so important in special for me that's information because as the student trustee, as the president of the SSG, I represent nearly 30,000 students. In San Diego Community College District, we are 4 colleges. Mesa College, Miramar College, City College, and Continuing Education. But I would like to focus in continuing education because continuing education, the majority students are adult learners over 40 years, and also an immigrants, the student. And additionally, in continuing education, we don't have food bank. That is the reason I focus in continuing education. So as a student trustee at San Diego Community College, I represent nearly 100,000 students as delegate of the Region X of the Student Center for California Community College. I represent students across 9 colleges in Imperial and San Diego counties. We represent almost 2,200,000 students for the California Community College. So as lead pastor, one seat, I'm working with the vulnerable people at the community through the Gov Love in different social programs like the food bank and the Christian counseling. But that is the framing problem for us. The food insecurity is not only a social issue. It is an educational barrier that affect academic performance, student retention, and long-term economic development. So I hold every meeting with the authority at the continuing education because we are looking so ways to help the student at the basic needs. Right now we are signed the partnership through the one seat with the continuing education to find food for the student. So because we are seeing we have been seeing that in almost 2 years that the student can attend the class because we need to choose between class, work, attend the family, and also to eat. So that is the reason we really appreciated that information because that information helped us to our mission. But because I think more than the job, that is for me mission of life. Our student reality is many students face inflation, unstable employment, and family responsibility at the continuing education. Every day, the student must choose between food and another basic necessities. So, what is the main problem with the food insecurity? Because education and nutrition is coming together. Research show nutrition directly impacts the cognitive development. The hungers reduce concentration, memory, and academic performance. In continuing education, I told when I started in continuing education, we don't have food bank, we don't have dignity facility. That is the reason the student left this left 1,000 students without basic food support. Our goal in continuing education, our goal in one seat is gonna be to create a community dignity or community kitchen that give you food or almost we are planning to give you food the 3,000 students per week. 3,000 students per week represent 10% of the population because we are 30,000 students. With that project, we are working together to the continuing education through the basic need office and with the one seat organization. So that agreement with continuing education support student well-being and address food insecurity. Our initial goal is provide at least 2 dignified meals to the student per week. Right now, we are giving food, free food the student. We're starting 3 weeks ago. We're giving free food the student through some organization like the Life app. We are supporting us in the giving food the student and the homeless as well. And the another organization we are supporting us is the Minister Tiempo Nuevo. This organization giving us food to the student as well. We have something in the cost the proposal for the program the meal prepared. We estimate the 30,000 per week. With this budget, we can guarantee almost 1 or 2 lunch to 3,000 students. For us, this not charity. It is a student rotation, equity, and social justice. So how do we found this? We think that through the grant, partnership, faith-based, community support, pilot program. The pilot program is the community kitchen. So the faith-based, we are talking with another church that they have food bank program, and they can give it us food. So for us, it's enough, because right now we are working with three organizations, but we need to involve more organizations that help us to find more food for the students. Our operational model is central production kitchen, like the Mama's Kitchen. I saw in the last speaker. I saw the Mama's Kitchen. It's like it's the same idea. We have to give a meal prepared for the student at the community college. So because we need to distribute this meal through the student lunch and the 7 campuses, because in continuing education we have 7 campuses. So I working side by side with the president of the continuing education, with the associated student government. The associated student government, we have 14 senators. 2 senators represent each campuses, and this plan was approved in the General Assembly, in the last General Assembly, the last week, the last General Assembly, and all the leadership student at the community college, we agreed in develop that plan. Right now, we need to involve more organization to get more food, because if we find more organization that we give more food, we can expand the help and the student. So in help the student, give the food, the student, the immigrant student, and continue education represent to contribute in the economic impact at our city, because from the continuing education, we prepare all the students to work, to involve, to join, and the society. So that is the reason, or the main reason we need to attend the basic need in our students. The leadership, I said that this initiative has the full support for the student leadership. For us, it represents the social justice and the educational mission as well. is the social justice. Like the community, like my role as the pastoral through 1C, right now we are supporting the immigrant and homeless community around the Mission Valley. We are supporting the Jewish family service. They have the safety parking every week. We are giving almost 100 food painted and meal prepared food to these homeless people. So as 1C organization, we are giving almost 300 meat per week. For us, it's so important because weekly food distribution is made possible through the nonprofit and private partnership. That nonprofit, I mentioned it when I begin, like the Life Ad, el Ministerio Tiempo Nuevo, and another church. So more than the class, for me is that participation is like the testimony, the important to give it for the student, the testimony we are doing around our community and our community and Mission Valley, because I know that Mission Valley have the good position, economic position, but when you walk the street, you can see the reality. We are some homeless as well in that community. I would like to say you that investing in a student means investing in our economic future, because from the continuing education, we are preparing the student to give the society, to give the country, to give the county, to give and also to give the company the tool necessary to develop our society. And educating our society leads to sustainable development. I think finally I would like to call to action. So we are seeking partnership for food supply, physical space, logistical support, because we think that hunger must not remain too barrier to learning. I would like to say something that Martin Luther King Jr. say: injustice anywhere is free to justice everywhere. So in that sense, Jesus Christ say, "For I was hungry, and you gave me food. I was thirsty, and you gave me drink." Thank you for your time. Thank you for having me. Thank you for showing me a lot of information that encouraged me to keep it doing, to keep it help the student, because my role as a student trustee and president of SHG is to help the student. But every day I hear from the first hands from the student what is the real needs that they have. Thank you for this community that today we can talking about that need, because I think when do you have hungry, you can learn, you can and all you can stop to attend your class. I think for me is all.
Okay. Thank you so much, Dr. Melendez. Thank you so much for your presentation, for that reflection, and for all the work that you do for the students, such a wonderful group, especially at this time, serving immigrant students and folks experiencing homelessness and such a critical time. Um, we can take a question if there's any questions for Dr. Melendez. I'm going to pause. If not, if you can leave your information with us, or we have your information, we can share with the group and extend your invitation for your call to action to support your efforts to extend reach. So thank you so much. Once again, we appreciate you and everything you do. And go ahead, Dr. Melendez.
Thank you so much, Miss Janet.
Yes.
For this special time. I hope to join us in the future conference, because all information was important for us, and especially for me, because that is my role as a student trustee, to find basic need for the student that they have. They need a lot of help.
Thank you, Dr. Melendez. And we're going to transition in the interest of time to our last speakers. Our last speakers also have impressive bios that we will share at the recap email, but collectively they bring years of experience helping state and local government and community-based organizations to improve services to vulnerable populations, including supporting the County of San Diego's MA program by focusing on effective implementation, compliance, and stakeholder collaboration. Now I would like to turn it over to the MA team.
Thank you, Janet. I believe Cassandra is going to pull up our presentation.
Yes, can you see my screen?
I see advancing throughout the year. This is the slide I'm seeing. Thank you. So good afternoon, everyone, and thank you for letting us join you today to talk about medical administrative activities, or what we refer to as MA. In this presentation, we'll provide a brief overview of the MA program. We'll give some examples of MA activities and how they relate in the real world. We'll also discuss the program requirements and go over how reimbursement works. And we will have a Q&A session at the end of the presentation. Next, please. So this is our MA team. I'm Elisa Mack. I'm the program specialist for Hansine Fisher & Associates, and we support the County of San Diego's MA TCM unit. On the left, you'll see Benson Swango. He is our MA coordinator for the County of San Diego. He's not able to join us today. We also have Doloreza. Reza, do you want to go ahead and introduce yourself?
Hi, everyone. My name is Dolores Arunay. I'm the MA Outreach and Training Coordinator for the MA TCM team. Chansey, do you want to go next?
You're muted, Hansine.
Sorry, I'm Hansine Fisher. I was talking into the thin air. I'm glad to be here. We've been working continuously with the county since 2005 on all things MA, and hope we can give you some information today. Thank you for having us.
Thank you, Nancy. Next slide, please. So what is MA and what is the purpose of MA? So MA allows participating LGAs and community-based organizations, or CBOs, to receive reimbursement from federal Medicaid for costs of performing administrative activities that directly support efforts to identify and enroll potentially eligible individuals into Medi-Cal and Medi-Cal covered services. So important things to note is that staff performing MA must be funded at least in part by state or local funds. So staff who are 100% federally funded are not eligible to claim MA. So next slide, please. And Hansine will go over the Medi-Cal administrative activities and then talk about some program requirements as well. Hansine?
Yeah, I think listening to all of you speak today and looking at the huge number of people who are on the call, thought it's important to stress that MA is everywhere. It's a program that the federal government supports based on things that you're already doing. And so you are able to be reimbursed for them as long as you have state or local monies supporting those costs in part. There are three major buckets of activities in MAW. One is outreach, where you might be informing individuals about Medi-Cal, its benefits, encouraging them to apply, assisting them to enroll. I think as we move deep into HR1 and all the changes in eligibility requirements, we're hearing that already, that many of the people that you're coming in contact with are wanting to know, what does that mean for me? When you're telling them that, that's something we would call Medi-Cal outreach, and that would be a reimbursable activity. It also includes assisting people to apply for Medi-Cal, troubleshooting anything around applications. The middle bucket is called referral. It's actually kind of three words. It's referral, coordination, and monitoring activities. This does not have to be a formal kind of case management activity. It could be incidental to other work you're doing. I was thinking, we heard from another place that in the library, the public library, they have staff who are referring people who come into mental health services. So it can happen anywhere in the county. The people who can do MA can be any person whose job title sort of includes that activity. You don't have to be educated this way or educated that way or working in this kind of an agency. It's just really if your staff are doing the activities. It's not just the referral, it's also coordinating and monitoring, like following up to see if someone did get to the medical services they need. Did they get to the behavioral health treatment that they were wanting to get to? Are they able to access medication from their pharmacy? The other key bucket in my is sort of, I'd call it a backroom activity because it's not client facing. But this is program planning, policy development, and interagency coordination to improve the delivery of services, Medi-Cal services, by increasing access and reducing barriers. So I'm thinking in these sessions that you do, you might have a session on barriers to behavioral health care, where you're talking about as a group, how can we reduce some of these barriers? How can we increase access? If you were doing MA and you were in this meeting and you were talking about these things, that would be a reimbursable activity. So we have some examples that we've pulled from other programs that are already doing MA that might be helpful to help you understand sort of what really MA means in the day-to-day work of your agencies. So here under outreach, we have someone who's at a health fair or a healthcare event explaining upcoming changes in Medi-Cal eligibility. That could be done in a presentation somewhere. It could be done one-on-one in a tabling event at a health fair. A second one would be providing information to an unhoused person that Medi-Cal will cover the cost of a prescription, where someone says, well, I need this, but I don't have the money. And you can say, well, that's a benefit, something that Medi-Cal will pay for. Well, I'm not enrolled in Medi-Cal, but we can help you get enrolled. Under the referral, coordination, and monitoring, we have a couple of examples here where you might be assisting a client to make an appointment with a medical specialist. Maybe you run family resource centers or senior resource centers, and you see the same people coming in over time, and they get to know you and they say, I think I really should go see the doctor, and you help them find a resource. Even though that's not the main part of your job, it is something you would do if it came up. Here's another one, participating in team meeting with or without the client present to coordinate their medical and behavioral health services. Some of you may be working kind of in tandem with other agencies to help your shared population get to services that they need. And you may do these case conferences so you're not stepping on each other and on the client, not having it all coordinated. Here are a couple of program planning and policy development examples. One is planning a leadership event with a local hospital, because a hospital is a Medi-Cal provider, offers Medi-Cal services, to discuss ways patients might be diverted from the ER and still get timely care. So all of that discussion about how you could divert people from the ER, make sure they get care on time, that would be something that would be covered by MA. And it's not just the meeting itself, but say I had to drive to that hospital, the time that I drove there, drove back would also be counted as part of the activity. A second example under this program planning and policy development is meeting with a community partner to review an event we did on Medi-Cal services for frail elderly residents. So this might be like an after action meeting where you're going, well, how did it go? Should we have had more of this? Was the setup right? That would also be part of your kind of program planning, because you're doing a look back in order to make the next one be even better. So those are the very broad picture of the range of MA activities. Here are some basic program requirements that you would need to know. The way that we figure out how much reimbursement you would generate in MA is driven, first of all, by a time survey, where everyone who's doing MA has to track their time through some sort of time survey. So there are two kinds of time surveys. One is called a perpetual, and that's what it is, perpetual. Staff would document 100% of their activities on a web-based or a Excel-based form, where they would have a group of activities that they would assign their time at the end of every day, say, and that time would be grouped in 15-minute increments in a specific activity. So let's say I went to that health fair and I was just really talking about Medi-Cal and the changes in HR1. I drove out there, I did the event, I came back, I was gone for 3 hours. I would put 3 hours in a code for Medi-Cal outreach. I might also be direct charging my time, which is, rather than doing this perpetual time survey, I would just keep the most of all of my job might be doing outreach about Medi-Cal and Medi-Cal services. In that case, I could direct charge and only report the time that I was doing that outreach activity. So these two time surveys are really geared to the range of MA activities that you and your staff provide, and then deciding on a person-by-person basis what's the best kind of time survey to use. They're both tracked in 15-minute increments and can be rolled up at the end of the day. The main requirement for people who are participating in MA is completing the time survey and doing that accurately and regularly. The one other big thing that has to happen is that staff have to be trained before they start their first time survey, and then complete an annual training after that. And part of the goal of that training is that staff are able to know a MA activity from a non-MA activity. So a lot of the training that the county does focuses on that, because the feds want to know that you know what the code means. There is there's an invoice that's developed at the end of the quarter that takes the people who time surveyed, figures out the percentage of time in MA, puts that against costs, and that's how you create an invoice. So there needs to be somebody in the agency who can pull general ledger reports, payroll documents. The county prepares the invoice for you, you look at it, you review it, you sign it. And the other thing that happens, you will also need to keep an audit file that would include copies of your time surveys, the backup for your invoice, timesheets that prove that if someone worked 80 hours in a 2-week period, the payroll report will support that. And last, there's a memorandum of agreement that's signed between the county and your organization if you were going to participate. It's a pretty straightforward agreement, can be processed pretty quickly. So, Rezi, I think you're next.
Yes, thank you so much, Hansin. Here we'll go over the reimbursement. Hansin touched a little bit on this. So the main 4 factors for reimbursement will be actual cost of performing my activities, the type of my activities that were performed, the percentage of medical clients that were served, and having state and local funds paying for these activities. Keep in mind that no new money is required for participation in the MA program. A quarterly invoicing will take place, as well as a MA admin fee for program administration, oversight, and an audit reserve will be held. MA reimbursement funds, after they are received, they will be unrestricted for use. Next, we'll go over an example of how these reimbursement factors come to play when you are calculating the estimated quarterly invoiced amount. If you can go next, please. Thank you. So here in this example, we have a total quarterly cost of staff performing SEMA activities around $500,000. We'll multiply that by the percentage of time that staff spent on MA activities. We take an average of 30%, and then we'll multiply that number by the medical discount factor, which is around 50%, and the federal financial participation rate at 50%. So at the end, the total will come to $37,500, which will be the estimated quarterly reimbursement that, after received as well, as I said earlier, will be unrestricted for use for the CBO or the county department that is invoicing. Next, we'll go over the administration of the MA program. So here we have the organizations that administer the MA program. On the federal level, we have the Centers for Medicare and Medicaid Services, also known as CMS. They oversight national Medicaid policy and funding. On the state level, we have the HCS, which is the Department of Healthcare Services. They are in charge of administering Medicaid program within California, including the SEMA program. On the county level, we have local governmental agency known as LGAs, such as San Diego County, and we are in charge of administering the SEMA for the county and coordinating SEMA program activities, training, and submitting invoices to the HCS. Other program participants will be county programs, subcontractors, CBOs, local public entities, and schools who are providing outreach, referral, application assistance, and program planning and policy development for the SEMA program. Next, we'll go over the organizational structure. The MATCM program unit sits within the Public Health Administration that falls under Public Health Services, that is a department within the Health and Human Service Agency, also known as HHSA, within the County of San Diego. On the next slide, you'll find our MATCM staff information, our titles, email information, and as well as a short description of the main functions. If for any chance you have questions, you want to reach out, please feel free to reach out to anyone within the MATCM team, and we'll assist or coordinate your questions. Next, we'll go under the questions section. I will read the question, Hansin, and if you can go over the answers.
Sure.
So the first question that we received was, Is MA limited to county entities, or can other organizations or non-profit utilize it?
Thank you, Rosie. So as I said right at the top, MA is everywhere and in everything just about. So if you are an organization, a nonprofit, you are certainly eligible to participate in MA. It is not limited to county entities.
Thank you so much, Francine. The second question we received was, who or how can you access reimbursement through Medi-Cal?
Well, I think it would be a series of steps. If you are interested in learning, we did this crash course in MA. If you are interested in learning about MA, you should email Elisa, whose email is on the slides here, and we would set up a meeting with you to talk about MA, to talk about the kinds of activities and the staff performing those activities. We would want to talk about your funding to make sure that you did have enough state or local funding to cover part of the cost of the staff, and that would cover their MA activities. You would need to get if you decided you wanted to move forward, there would be an MOU that would be developed. There's a template, it's pretty cut and dried, that you would need to sign. We would work with you we try to do MA from the ground up because the federal language is a little stiff and stuffy. And so what we like to do is some sort of roundtable with at least some of your staff to find out what their daily work looks like. And then we incorporate that information into the training that's required before you start participating. And then so now you're good to go. Your staff start time surveying. At the end of the quarter, it's every quarter, there's a new time survey. At the end of the quarter, we'd roll up those time surveys, figure out what the percentage was, and that would be the first step. And then you would pull the salaries and benefits of the staff who did have time in MA in the time survey, along with the general ledgers of operating costs and your indirect rate. And we would put together an invoice for you, send it back to you for review, and it would be submitted. We have to tell you the bad news is that the first payment for MA sometimes takes up to 18 or 19 months, only because the state is backed up and there is a rule in MA that you can wait up to 15 months before you submit an invoice for a prior quarter. And during COVID, everybody got behind, and so there's this gap. Now they're trying to catch up. It's probably taking a little less than it did now. But once that first revenue comes in, you will see revenue coming in on a steady basis every 3 to 4 months after the quarter ends. But it's not in a fix right now. It's a long-term process with steady reimbursement coming in as long as you continue to have some state and local funding that's not federal at its source. That was a long answer, but
Thank you.
It's not quick.
Thank you so much, Francine. The last question we have here states, what are the eligibility requirements for MA reimbursement?
Well, I think, we sort of talked about those in the question before. First is that you have to have staff who perform MA activities, not all the time every day, but on a pretty regular basis. They would be going to health fairs or referring people to services that Medi-Cal covers, medical care, behavioral health, substance abuse, medications. They would time survey. That's the next requirement. They would have to be partly funded with state or local monies. Those are really the 3 key requirements, along with being trained before they begin to participate in MA and doing the invoice after the quarter is over. There's no requirement on which kind of staff can participate. It's not limited to nurses or social workers. It could be an outreach worker, a community health worker. It could be the director of the organization who's involved in a lot of planning. It's really looking sort of employee by employee at their job description to see, does it include at least one of those three buckets we talked about earlier: outreach, referral, and program planning / policy development / interagency coordination.
Thank you so much.
Thank you.
On the next slide, we'll go over some helpful websites that you can go to if you want to learn more about the MOP program. We have the DHCS website, the county website, and the LGA website. That concludes our presentation. If you have any questions, please feel free.
Elisa put her email in the chat, so this is a lot to throw at you in 12 or 15 minutes, but feel free to give Elisa an email visit and we'll follow up with you. I think it is, again, as long as you have a pretty steady source, you can change your revenue may change over time, but as long as you have some state and local, MA is a nice way to have steady income coming in. And the best thing about it is there are no restrictions on how the funds are used when they come to you. So you can push them back into staff. You can buy things that you want. Dr. Melendez was talking about his food program, and some of you were talking about the need for donations. You could put the money into food if you wanted. There are no restrictions on how the money is used, as long as it's legal.
Well, thank you so much. I anticipate that you're going to get a lot of follow-up emails. Thank you for putting the spotlight at this opportunity. Very, very timely. And thank you to all of our amazing speakers, and thank you for all your amazing questions. Before we move on to the next agenda item, I would like to invite you to provide feedback about today's webinar. There's two very short questions. Basically, it's what you learn and how you apply it. We'll share the link in the chat, and you can scan the QR code to complete it. There's no wrong answers, and we'll give 1 or 2 minutes for you to fill it out. And then we'll pause then for you to complete the feedback form. Since there's only 2 questions, if you complete it right away and you do have announcements, start getting your flyers ready and your information ready. We'll might have time for a few announcements, very brief, but still leave your information in the chat or your announcement in the chat. If we don't get to you, we'll still make it to the recap email. Okay, thank you for your feedback. And with that, I'm going to turn it over to my co-chair, Valerie Brew, for last part of our program.
Great. Thanks, Jeanette. As Jeanette said, we are now looking forward to hearing any updates, community events, or collaborative opportunities that you might want to share with a larger group. In case we only have time for a couple, I see people are already doing this. Please put any links, flyers in the chat as well. So if you could raise your virtual hand, which I already see a couple raised, that way our team can work on unmuting you. So I see see. Is it?
Hello.
Yes, hi.
Hi, my name is Shalyn Gary, and thank you so much for the beautiful presentations today on food insecurity and how we can connect our clients to different food resources. I'm with Child and Family Wellbeing Department, and I'm the Community Outreach Liaison. And I just wanted to share a brief announcement. The County of San Diego Child and Family Wellbeing, we're dedicated to promoting the safety, stability, and thriving of children, youth, and families. And for 25 years, the San Pasqual Academy has sheltered more than 1,000 foster youth, offering stable long-term placements, an on-site high school, independent living, skills preparation, therapeutic services, work readiness training, and extracurriculum activities and social stabilization. And so within the last decade, federal and state legislation has shifted away from the model of this educational-based residential program, and the number of children have been reduced in that facility due to more youth children being placed with their relatives. And so there has been a work group last week, a focus group last week that took place on March the 3rd. But the survey is still open, looking for you all's input for that. And so that closes on March 20th. And so I'll share in the chat. Please take the time to review that and share with others, because we would really love your input about San Pasqual Academy. Thank you.
Thank you, Shalyn, very much. And I see another hand, Cassandra.
Hello, everyone. How are you? My name is Cassandra Zahner. I'm a peer support partner and I work for NAMI San Diego. And we're going to be having our 12th annual mental health wellness celebration. And let me tell you a little bit about it. All right, so we warmly invite you to celebrate. And it's May 2nd, Saturday, 2026, 12 to 6 p.m. at Brick in Liberty Station. Many organizations will come together with resources that serve San Diego County. There will be activities to join in, vision board station, self-care kit, and our theme is learning how to grow. We're going to have face painting, free pizza, shaved ice. We're going to listen to speakers share their mental health stories, and participants can lead in activities. And so we're going to have a great time, and I'm going to put the flyer in the chat. So if anyone, also organizations, would like to table the resource booth, you can email me. All right, guys? Thank you so much.
Thank you, Cassandra. Any other updates or announcements? And I apologize if I'm not seeing hands. I don't know if the team can help if we see other virtual hands being raised.
I don't see any. I do want to bring attention to something that I just added on the chat. The County Food Justice Community Action Plan workshop. It was very relevant. It's tomorrow at the Livewell Center. I just added the link if you would like to attend to provide input to a very relevant topic. And I did see somebody else. I think it's Will.
Can you hear me? It's Tabitha Wilburn.
Yes, we can hear you. Go ahead.
Okay, my apologies. I wasn't quite sure if it was head because sometimes my volume is a little low. But we are having the San Diego County Probation Department. We're having us for the North County Community Resource Fair. I wasn't sure if that was shared already. It'll be on March 11th at the Vista Courthouse in North County. The services that'll be available, like free box, dry food, bag produce. They're going to be helping with housing navigation, employment services, mental health support, substance use treatment program information, and CalFresh assistance and more will be there. I'll try to put the flyer in the chat.
Great, thank you so much. Well, thank you again, everyone, for joining us today. You can stay connected to our Advancing Throughout the Years events by attending upcoming webinars on community health workers and data. And as you can see from the slide here, you can visit the Virtual Connection Hub website. And this page will be updated with today's recording. And just as a reminder too, we mentioned this earlier, if we missed any of your questions today, please email us and we'll be sure to answer your questions. And please subscribe to our newsletter as well. We can see that the link to that will be put in the chat. And thank you so much for your time together today. We really appreciate all of you joining, and we hope to connect with all of you soon. I hope you have a great evening this evening.